The advertising messages in this episode are brought to you by i3 Health. Are you looking for free oncology NCPD credits? Start earning today with i3 Health. Visit i3health.com to become a free member and browse our library of complimentary NCPD activities to get started. You're listening to the Oncology Nursing Podcast, where ONS Voices Talk Cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from bench to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast. Hello, and welcome to the Oncology Nursing Podcast. I'm your host, Stephanie Jardine, Oncology Clinical Specialist at ONS, and today we are joined by ONS member Cindy Dionysus, infusion nurse at Riverwood Healthcare Center in Aitkin, Minnesota, and nursing instructor at Central Lake College in Brainerd, Minnesota, to discuss how oncology nurses can safely administer etoposide chemotherapy and manage its associated adverse events. This episode is part of an ongoing series about outpatient oncology drug infusion. The others are linked in the episode notes. The advertising messages in this episode are paid for by i3 Health. Thanks for joining me today, Cindy.
Thank you for having me, Stephanie. I'm excited to be on the podcast.
Well, we're really happy to have you. To start us off, can you give us some background on etoposide?
Yes. Etoposide, that's the generic name. It's been around for a long time. The American Cancer Research did a paper in 1991 about the podophyllum plant. It was found to have anti-cancer properties in 1861. In 1966, synthesis and first biological testing was started for etoposide. Clinical trials were started in 1971. I was born in 1969, so that's 50 years ago. The FDA then approved it for use in 1983, so it's been around for a long time. It is a plant alkaloid. It's originally from a plant, the physome of the wild mandrake, the Podophyllum peltatum or Mayapple plant in the United States, possesses anti-neoplastic properties. It's now semi-synthetic. It's a derivative of the podophyllitoxin with a D-glucose derivative. When I started giving etoposide in 1994, we called it VP16. The name is thought to come from one of the chemists, von Wartburg, and the P from podophyllum. The code given to etoposide back then was VP16-213. And I think that's where it originally, the VP16 came. The 213 just dropped off. Other trade names for etoposide are Toposar, Bepicid, and Etopopose.
That's so funny that you say that, because that's how I remember this drug being called, was VP16. So I think nowadays they don't use that name quite as much. So you're right. What is the drug's mechanism of action?
Etoposide works primarily in the G tube and the M phase of the cell cycle. It's given in different cycles for different chemotherapy regimens. It's classified, like I said, as a plant alkaloid and a topoisomerase 2 inhibitor, which is an enzyme that cancer cells rely on more than healthy cells since they divide more rapidly. Etoposide causes breaks in the DNA, preventing mitotic phase of cell division, leading to cell death. Etoposide inhibits DNA synthesis by forming a complex with topoisomerase 2, and that leads the tumors to die and shrink.
Well, now that we know a little bit about the background and how it works, what are some of the cancer diagnoses?
We treat small cell lung cancer. That's a primary agent for small cell lung cancer, and testicular cancer, also non-small cell lung cancer, Hodgkin's and non-Hodgkin's lymphomas, rhabdomyosarcomas, ovarian cancers, and gastric cancers.
Well, then it's definitely used in a lot of different diagnoses that are pretty common diagnoses that we would routinely see, or our listeners would routinely see in their practices. So with this medication, as it is with many cancer treatments, there's definitely side effects and adverse events that happen. What are some of the most common ones that patients may experience from etoposide therapy?
Some of the most common side effects that I see when I give etoposide are hypotension, alopecia, myelosuppression of the bone marrow. That includes the white blood cells, the hemoglobin, the platelets, and then some more minor side effects, but they do still occur, are nausea and vomiting, mouth sores, and some diarrhea.
So again, like a lot of our other treatments, very similar side effects that the patients could experience, let me say. I know that etoposide is considered an irritant, so it may cause inflammation of the vein through which the drug is administered. What other types of infusion reactions should nurses be aware of when administering etoposide?
You're right. Etoposide can cause inflammation of the vein. So we tend to use larger veins. And where I work, we try to use the veins between the wrist and the antecubital area. And central line infusions are well tolerated from these patients. There are some hypersensitivity reactions that occur in patients receiving etoposide. Those reactions are hypotension, chest discomfort, flushing, shortness of breath, and sometimes bronchospasms. In most of the reactions, they usually occur within 10 to 15 minutes, 5 to 15 minutes of starting the infusion. And usually they have a complete recovery once we give them some medication. Very rarely do we see the infusion reactions happen hours after, but I have seen some happen hours after the infusion. Treatment of the hypersensitivity reaction is to immediately stop the infusion, give antihistamines or steroids and or IV fluids for the hypotension. And then we may need to give subsequent pre-treatment medications and additional steroids for any further treatments to prevent those kinds of infusion reactions.
It's really important, I think, for nurses to understand what infusion reactions might happen with any treatment that they have. So what kinds of precautions should oncology nurses take to minimize the risk or quickly manage an infusion reaction with etoposide?
It's a great question, Stephanie. What we usually do for every patient, especially when it's their first treatment, is we educate our patients about these infusion reactions. So educating the patients means to have them call if they have any symptoms or feelings different from how they feel prior to the start of the infusion. And then we want the patient to inform the staff to call the nurse immediately if they have any new symptoms so we can investigate that concern, or if we need to stop the infusion and give those medications as needed. The second thing we do is we monitor all first dose chemotherapies closely for the first 15 minutes. Then we are able to pick up subtle changes that the patient may have, like if they start having chills or flushing, and we are able to see those things right away. And then for subsequent doses, we have the patient call for any new changes during the infusions, same thing. But we just don't stay as close to them as we do the first time. And then prior to infusion, we assure that all of our equipment is ready. So we make sure that we have O2 tubing nearby and we have an oxygen source. We make sure that we have our vital machine next to the patient and we have a crash cart in the room and operating well. And then we have emergency medication near. And where we work, we have emergency medicine kit in a box that we keep at our nursing station. So we can just grab that if we see some adverse reactions happening.
Thanks for explaining that. I think, as I said, it's so important for nurses to know what they need to have close by, what kinds of things they need to look for, and just being able to manage that quickly, because most of the time they come on very quickly, these reactions, and it's so important to be able to address them and take care of them quickly so that they don't escalate, to a point where they might have to, have more intense management taking, with the infusion reaction. So does etoposide have any black box warnings or precautions? And if it does, what does that mean for administration and post-administration care?
Yes, etoposide does have black box warning, and it's for the oral and injection. Etoposide should be administered under the supervision of a qualified physician experienced in the use of chemotherapy agents. Severe myelosuppression resulting in infection or bleeding may occur. That's what it says on the box. And what that means is it should be given by educated professionals with experience with chemotherapy and its side effects. Post-administration side effects of myelosuppression can cause side effects of infection and bleeding if blood work isn't closely monitored after the medication's been administered.
That's very important. And I think that's another really good point that we're bringing out today is how important it is to look at the drug sheets and see if there are any black box warnings, because those kinds of things, sometimes, we feel like they're the small print, but they're so important for us or for new nurses and new nurses to oncology are aware of when our patients are getting these kind of treatments. And especially when, the cancer treatments can cause you to have lower blood counts as well. So you've got to kind of pull all of those things that into account, whether it's the disease process or the side effect management of the treatment that they're giving, and just all of it. And it can be very complicated. So is etoposide used in combination with other treatments?
Yes, Stephanie, it's used in combination with other chemotherapy agents to aid in the reduction of tumors. The nursing considerations of patient management for the combination drugs, including with etoposide, are to monitor the side effects of each of the chemotherapy or biotherapy agents and educate the patients about all the side effects, and then monitor their blood count levels and any side effects that might occur related to the lower blood count levels. Administration of combination drugs are given in an order of sequence. And what we use is the NCCN guidelines, which is the National Comprehensive Cancer Network, for treatments and regimens, because they use evidence-based blocks to inform practitioners which medications to give and in what order, including pre-medications before chemotherapy.
Those guidelines are so helpful, especially to somebody new coming into oncology, and being able to see what the different combination therapies are that they could, be administering at some point. And like you said, even seeing the pre-medications and how important it is to know what those pre-medications would be. The advertising messages in this episode are brought to you by i3 Health. Finding time to complete continuing education activities and earning NCPD can be a challenge. That's why i3 Health has made it easy to earn free NCPD and ILNA points with online activities and podcasts. Visit i3health.com to check out our library of complimentary NCPD activities that can be completed online or on the go. Start earning contact hours today at i3health.com and explore our current offerings. Are there any contraindications to using etoposide?
Yes, the only contraindications that I saw when I was researching it and looking at the package insert is if any patient were to have like a severe hypersensitivity reaction to etoposide, where they may have not recovered well or didn't do very well, that might be a contraindication or a reason to maybe try a different drug because the patient doesn't tolerate etoposide very well.
So, Cindy, what patient education should oncology nurses provide before they administer etoposide?
Stephanie, that's a great question, because I always do this for every patient, and so does the staff that I work with. So what we do is we especially if it's a new etoposide is the first time they've had it, is if it's a new drug, we explain the name etoposide, and we would explain like if they heard the name VP16 and other brand names that they might hear. We tell them how the drug works on the cancer cells, and we tell them how it works on the non-cancer cells in their body. And then we tell them how the etoposide will affect their body and the side effects they may see, and then how important it is to call us to let us know if they have any concerns about these side effects. We give them phone numbers to call for questions or emergencies, and we give them examples of what emergencies are. We also educate them about their diet, and we educate them about exercise and how to recognize and combat fatigue. We also educate them on the importance of getting their lab work complete and what the lab values mean, so they feel like they're a part of their care.
That's really good and so important. The more that we educate our patients on what to expect with their treatments and how important it is to let us know if they are having any symptoms or anything like that, or anything just seems off or not right, that it's just so important to give them the permission. I'm going to say, even though we know they have permission, but so they feel like they have permission to let us know, and that they're not bothering us because we're such busy nurses, but that we really do want to know what's going on and how important it is that they keep us aware of how they're feeling. There are a couple questions that I like to ask at the end of all of our podcasts together, and so I'm going to start those with you now. The first one that I have is, what is something about etoposide that's not often discussed, but you wish more people knew about?
Initially, in 1994, when I started using etoposide, there was no need for an inline filter. So I think that's just recently changed in probably, the last 10 years. But now, according to the manufacturer, the diluted solution of etoposide should not exceed 0.4 milligrams per milliliter, because precipitation can occur. So for those patients needing larger doses, like the larger patients will need larger doses, or the patients who are fluid overloaded, who don't need those big bags of etoposide, it may be best to talk it over with the physician about all this fluid that this patient might get. And like I said, a lot of the non-small cell lung cancers and the small cell lung cancer, some of them have some difficulty breathing. And if they're very large people, sometimes you may need to let the physician know, hey, this comes in a liter bag, and this person is already having some difficulty. So that might be something you need to discuss with the physician, to either give a diuretic or something to help with this extra fluid that the patient might need. But patients will need an inline filter for all etoposide infusions to prevent that precipitation.
Good thing to know. So what additional training or education do oncology nurses need to administer etoposide?
Our nurses need to have unit competency signed off on etoposide prior to administering etoposide independently. Nurses need annual competency checkoffs, all chemotherapy administrations.
Thank you. As I mentioned in the introduction, you teach at a school of nursing. So as we're talking about all of these things that are important for oncology nurses to know about with etoposide, what kinds of things would you be teaching your nursing students who may have an interest in oncology, or who you take to their clinical rotations in an oncology setting?
That's a great question, Stephanie. I do send, because oncology is my passion, I do send my students to the oncology infusion area to learn. And I do just a very basic teaching with them. I tell them about how biotherapies work on the body, and then how chemotherapy works on the cancer cells and on the healthy cells in the body, just basic information. And then basically the areas that it will affect, like the GI tract, the hair follicles, and the bone marrow. And then I will have them, just very basic information, listen to the admission assessments on these patients, and they pick up on all of these side effects that the nurse will ask about, and they will come back to me and tell me, they were all the side effects that you mentioned, those in those areas. So I have them try to hone in their assessment skills by listening to the nurse and pick up those little details. And then I just have them pay attention to central line care and pay attention to how to draw blood from a central line and how to care for patients and give compassion when somebody is struggling. So those are a few of the things that I teach the students. And then we do have chapters on immunotherapy and chemotherapy. So when they go to the unit, they do see and learn more of the information.
Thank you. That's great to know. I think that we know that nursing students don't have a lot of oncology curriculum in their overall curriculum. So for me, I think it's really exciting when we have oncology nurses who are really passionate, about this specialty and are teaching our new nurses that are coming along and just giving them the experience to be able to work in the oncology areas. I know personally that was, how I got into oncology was, from having that experience when I was in school. So I think that's great that you do that. And then lastly, what are some resources about Etoposide for patients and providers that you could recommend?
The resources available for Etoposide for patients and providers that I see that we use a lot is the NCCN National Comprehensive Cancer Network guidelines. And the patients can also look at the National Cancer Institute, cancer treatments and chemotherapy types, and then the American Cancer Society, treatments and side effects and treatment types, and that will help them find basic information that they can look up regarding the kind of cancer and chemotherapy that they're going to be getting or a loved one will be getting.
Well, thank you. And Cindy, I just want to thank you for joining me today to give us some information on Etoposide, administering it, and the management of any side effects or infusion reactions that may happen with patients receiving this treatment. And I thank you for your passion and your expertise in this area. And I just want to ask you if you have any final comments for us.
I did want to mention, and I forgot to mention earlier, that Etoposide can cause secondary cancers. And one of the most common secondary cancers that it can cause is AML. It's a SMN, or second malignant neoplasm, associated with Etoposide. And then dose reduction if a patient has renal dysfunction, because 30 to 50% of Etoposide is excreted through the urine. So I thought those were important to note with Etoposide also. And thank you for having me also. I really enjoyed it.
Thanks so much for joining us today. I know that our listeners will really appreciate the information you shared.
Thank you.
The advertising messages in this episode were brought to you by i3 Health. Continue to develop your career and enhance your practice with evidence-based, fair-balanced, free NCPD approved activities from i3 Health. Start today by visiting i3health.com and register as a free member. Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part of this episode by leaving a review on iTunes or wherever you downloaded your podcast. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org. The ideas and opinions shared in this episode represent those of the guests and not necessarily ONS.